So good afternoon, everyone. I think I have slides. I, too, am really, honored to be here today to be a part of this incredible conversation and also to be a part of an interprofessional solution finding that we are all, I think, dedicated to. I'm also here representing my colleagues at Johns Hopkins, both in our academic School of Nursing and our practice environment. And having done really 3 decades of interprofessional work today, I'm going to talk about a program that we've been working on, the Mindful Ethical Practice and Resilience Academy, MEPRA, that's focused on nurses. And you heard from Dr. Moss earlier this morning about some of the findings of the challenges that nurses experience in their roles. As an example of that, 2 Fridays ago, I was called by a nurse in the intensive care unit about a patient who had been in the unit for many months, had had a very extensive surgical procedure, and in the post-operative period had experienced multiple complications that really resulted in multi-system organ failure. She was calling because of her distress in caring for this gentleman, not because the work was too hard, but because of the emotional burden of feeling that what she was doing was actually causing more harm than good. And she wanted some help. So I came and met with her with an interprofessional team, the physicians, the nurses, the social workers who were involved in this case. And as she began to talk about her experience of what it was like on a 12-hour shift to provide care for this gentleman, tears began to fall from her eyes. And the team, sitting together, sat with that response. And the attending physician looked at her and said, "You know, I wish I could stand in your shoes. I can't imagine what it's like to provide care that causes this kind of distress for 12 hours. I can come in for 10 minutes, but I can leave, and you're here." And it was in that moment of compassion in action that we can begin to see how important it is for us to come together as teams, to support each other, to be able to actually acknowledge our common humanity and our shared goals. And so that context, I think, is important in seeing how when there's a gap between our values and our behaviors, there's distress and stress. It compromises our integrity and our resilience and our work engagement. So that was the reason that we created MEPRA. And we created it with sort of 3 goals. One was to create a foundation of mindfulness so that not that we could push away the experiences, but that we could actually work with them more skillfully, that we could develop a more robust sense of ethical competence and resilience. And by doing this, we created a model that really the spine of which is moral resilience, the ability to cultivate the capacities to restore or preserve integrity in the midst of moral adversity, as well as self-regulatory and self-awareness, moral sensitivity, discernment, and action. So we created a 6-session program, 4 hours each, that is a technology-enabled program that has mindfulness as the foundation. The participants receive an email daily with a guided meditation and a reflective practice focused on things like gratitude. In addition to that, we have 4 4-hour sessions that include all of these various dimensions, beginning first with who we are, what we stand for, and what our values are. And it very much connects with the healer's art, I think, in that connection and focusing on values. Then focusing on how can we self-regulate our nervous system in the midst of these incredibly complex environments that we're in, to cultivate empathy and perspective taking, to look at our assumptions and biases, and actually to be able to learn effective communication skills. We do that by using high-fidelity simulation to simulate those kinds of experiences so that we can practice in a safe environment. And then the final piece is the connection back to what are we going to bring to our community and contribute to our own ethical practice. We've done 3 cohorts, 71 staff nurses from a variety of settings. You can see the ages here. A variety of experiential and didactic, very little didactic actually, it's mostly experiential reflective practices. And the results I wanted to share from you from the people themselves. So,
MEPRA, for me, sort of redefined the importance of acknowledging the multi-dimensions of what it is to be a bedside nurse. We are the catalyst for the healthcare team. We are at the bedside, and we really have the ability to sort of unite everyone together in these very difficult moments.
And I really feel like it gives me the courage to speak up, but it actually just gets me excited about wanting to kind of be that go-to person. So having that ability to not fear speaking up, having the courage, having had the practice, wanting to be kind of like a go-to with your fellow nurses. I mean, even the senior nurses, I mean, discussing ethical dilemmas isn't always the easiest thing. So even though you may have 10, 15, 20 years of experience, it doesn't mean you're still comfortable speaking.
As somebody who's precepted a lot of nurses now and been a critical care nurse for 10 years, it's impossible to not get burnt out. And this has been the greatest breath of fresh air in my course of being a professional nurse. It really lets you take stock of what's important in your life and why you got into this job in the first place, and gives you a voice to be a leader in the clinical environment, not only in ethical situations, but just in challenging situations as well. I think my favorite part about this program is that your brain and your mind are also connected to your body, and that when you learn to integrate your feelings, your thoughts, and emotions into your somatic being, it really makes you a more present and more capable professional, and I think human being. Meditation has really reminded me of the nurse I want to be, that I want to be the person who can tune in and focus on the patient and really listen to what they need from me today.
So from a measurement point of view, our preliminary data suggest improvements in work engagement, ethical confidence and competence, as well as trending toward significance in resilience. So we're very inspired by what we've learned in this process. We are recruiting now for our 4th cohort, which will be a part of this research study. But here's where leadership really counts. We have been working now for about 5 years on a healthy work environment initiative in the hospital, and the department has adopted this program to make it available to all of our nurses. We are developing a MEPRA community of practice as a way to bring these skills into the local unit and community that nurses are practicing in with their interprofessional colleagues, and refining some of the tools that we've developed through this, as well as developing a MEPRA coach role. We are also looking to integrate this into our nurse residency program and expand throughout our hospital system, as well as developing a moral resilience tool. So when I reflect on what I've learned in this process, first of all, it's been an incredible privilege. I think that it is reinforced again and again that change is an inside-out process. It is not a thinking through process. It's actually having the courage to pause and to really take stock of who we are and what we bring to our work and why we do the work we do. It's also clear that we need multimodal methods for teaching. The simulation has been a very important integration strategy, and that really what we're teaching is a way of being. It is how we do what we're doing already differently by leveraging our connection to our purpose and our values. Just like every other skill that we need to have as clinicians, mindfulness takes practice and discipline. And it is a skill that can infuse everything that we do. And it's a foundation that I think really enables us to come together as a community to create solutions. We also know from the research point of view, if we're thinking about measurement, I don't think that many of our measures actually capture the full impact of these kinds of programs. And so I think we need to expand our repertoire of what we actually measure to document impact. We've also found this is a wise investment. We've estimated that it costs about $2,800 per nurse to provide this program. Our replacement costs for an experienced nurse are $94,000, and for a new graduate, over $100,000. So if you're thinking about an ROI, I think this is an investment that's worth looking at in terms of workforce. We also know that in many ways, I think that that burnout is a symptom. It's not the problem. I think that burnout is a reflection of the gap between our values and what we are actually doing and saying. When you hear us as we talk over and over again, we talk about the disconnection between why we're here. And I think that suggests to us that we need to really look at how we balance heart and mind. This is not a solution that is going to be solved with data alone. We have to be able to integrate who we are, why we're here, which is bringing us back all the way to patients and families. Because when you talk to nurses, they say the thing that breaks their heart is not providing good care for their patients. So I think if we can strengthen both of those elements, then I think we are on the road for really healing our systems and healing the people within them, because our systems are made up of people. And if we can enable them to be their best, then I'm hopeful that we can actually create a system that will allow us to really serve the people we're supposed to. Thank you.